I'm Kerry Fink with Helping Seniors of Brevard, and today is Friday. It's April 2nd. Amazing that we're already in April 2021. And wow, it's time for the art of healthy living, and that means our special guest is none other than Vicki Moore with CarePlus Health Plans. How are you today, Vicki?
I am doing great, Carrie. It's always good to be with you here on these lovely Fridays. I love getting together and presenting some great information to you and all of your viewers.
And what I love about today's topic, is this is really kind of an aspirational topic that I think we all aspire to. And it's called Living Healthy to 100. And so I'm really excited to get into that. Before we do, just real quickly, want to remind everybody we're in full swing with the Helping Seniors car raffle. That is, as you know, the grand drawing is scheduled for October 9th, Saturday, October 9th from 6 p.m. to 9 p.m. And somebody is going to win their choice of one of those beautiful brand new 2021 automobiles. They get to choose whether they want to drive home in a 2021 Chevrolet Camaro, Dodge Challenger, Mazda Miata convertible, or a Kia Sportage. So that's going to be a lot of fun. So you want to mark your calendar for October 9th, 2021. And we should be having an announcement very, very shortly about the 2020 Make Good event. And so that's going to be a lot of fun too. If you remember, we gave the beautiful Chevrolet Camaro is what Troy Darling of Indy Atlantic decided he wanted to go home in. In fact, he ended up going home in a Chevrolet convertible Camaro, no less. And I assume is enjoying tooling up and down US 1 with that thing, and bright red, beautiful car, and great day for him. But we had to do it, as you remember, outside the museum because of the COVID lockdown restrictions. And we promised everybody a good Make Good event coming up at the American Muscle Car Museum. And we are full speed ahead on keeping that part of the bargaining as well. So we're going to have a date to announce for that very, very soon, hoping that's going to be either late April or early May, but you will hear it first on Helping Seniors Updates. So on behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, one of the things that is such a pleasure, we're all about getting information into your hands so that you can make the best aging plan possible. And Vicki, just because of this topic, I want to take just half a second to reiterate something I like to say a lot of times is like, when we're really young and they're asking us, what do you want to be when you grow up? What's your plan? What's your plan? What's your what kind of job are you going to have? Are you going to go to college? And then when we get to be adults, they're telling us, well, you need to save for retirement. You need to save for your kids' college if that's what you're going to do. You need to plan this. You need to plan that. Are you going to buy a home? Are you going to get a mortgage? What are you going to do? So you have all these plans your whole life. And then we're planning for retirement and we arrive at retirement and somebody says, well, what's your retirement plan? And we start talking about 401ks and our savings and different things like that. But what Joe is talking about is a little different. He's talking about what's your aging plan, meaning we plan for everything our whole life. What happens if you're going to run into something as we go down the road that might happen or might not. We in Florida understand it probably better than most in the country because we understand hurricane planning, right? You don't want the hurricane to come to your house, but you do want to make sure you have a plan of what you want to do in case they say, hey, it is headed this way. And so that's the same way I think Joe is encouraging us to think about in terms of aging. We need a plan so that we have thought about different possibilities. Hopefully none of them come near our door, but at least we've sort of thought through what we're trying to accomplish in our golden years. And that's why I'm so excited, Vicki, about our topic today, living to 100. And I am sure you've got some great tips. The folks at CarePlus, I mean, you guys know you're a premier Medicare supplement, or not supplement, but you're actually
Medicare Advantage plan.
Medicare Advantage plan. Thank you,
Yes.
using the right terms. And so you guys are all invested about keeping our seniors safe and healthy. So I'm just really looking forward to hearing this today, Vicki.
All right. Well, yeah, and I love the idea of the aging plan, that you talked about. And that's the thing about aging is we just don't know. And we are living longer. And these are steps that we can take that we're going to talk about today to get us there. But yeah, as you said, you since we are healthier, living longer, smarter about things, we need to have a good aging plan in place. So that's definitely good information. And as you said, I am Vicki Moore. I am a sales representative at CarePlus, And this presentation was developed by CarePlus in consultation with the clinical staff. So I am in no ways a medical doctor. If you do have any medical questions, definitely, direct those to your healthcare provider. But if you do have any Medicare questions, that is where I come in, and that's where I can help answer any questions that you may have. And if you do so, you can always reach me at 502-777-6277. And I'll say that once again, it's 502-777-6277. And always happy to answer any questions that anyone may have. All right, so today we are going to learn tips to help you live your best life longer, how your attitude affects your health, important lifestyle changes that you need to know about, and the importance of focusing on your health care. There's no question that people are living longer than ever before. In fact, according to the Administration of Aging, since 1990, the percentage of Americans over the age of 65 has more than tripled, and life expectancy has increased by nearly 30 years, which is incredible. But, why is that? What are people doing differently? Well, that's what we're going to talk about today. So we're going to look at ways that we can age happily and healthfully starting this very moment. Live your best life longer. What are some centurion's secrets to a long, healthy life? Some of those would be, keeping a positive attitude, eating a healthy diet, stay connected, avoid alcohol and tobacco, focus on your health care, and stay active. And if you've tuned into our previous presentations, you're going to see a lot of the same themes echoed because they're all so important. So they're always definitely worth repeating and reminding. I will mention a quote by Woody Allen. He gave us this quote: if you can live to be 100, or you can live to be 100 if you give up all the things that make you want to be 100. So for some, this quote may ring true, but the ultimate goal is to strike a nice balance between living a healthy life and having a bit of fun too. So for the rest of this, we're going to be talking about simple steps that you can take to live your best life longer. And we're going to call these, centurion secrets. We're going to look at the importance of, as I said, keeping that positive attitude, making the right diet choices, the importance of physical activity and staying socially connected, and how to stay on top of your health care. The steps we'll share with you will be aimed to provide you with a good balance between making these healthy choices, and then of course still continuing to enjoy your life, which we all want to do. All right, so the power of a positive attitude. Positive thinking may provide many health benefits, including an increased lifespan, according to the Mayo Clinic. These tips may help you keep a positive attitude. So you want to try to, you want to think positive thoughts. You want to try to find the good, whether it's in people, or I'll just throw out there in politics, anything. You want to try to find the good in things. Find your purpose in life, build resilience, and laugh often. The first centurion secret is to have, that positive attitude. It's important to have a positive attitude, but realistic attitude about life. There are many potential health benefits of optimism and positive thinking. It may provide an increased lifespan, a lower risk of depression and stress, and better healing. The good news is that happiness is a choice. Sure, some people may be hardwired to be happy, but all of us, regardless of our disposition, can do things to nurture optimism. And I think that's very true. So if you're not one of those hardwired for happy people, then you definitely can, you can change that wiring. You can think those happy thoughts, and we're going to learn more about that. All right, so eat a healthy diet. Centurion secret number 2 is healthy eating. This probably isn't too surprising, but according to researchers at Boston University, obesity is rare in centenarians. And one of the ways to prevent obesity is by eating right. This means that a healthy diet is an important part of living a long, healthy life. But with all the different dietary recommendations floating around, it can be confusing to what is best. And questions abound. Are fats good or bad? Is a vegetarian diet superior to a meat based diet? And how much sugar do I need to limit myself to each day? So many questions. There is a book by an author named Dan Butner. It's called The Blue Zone Solution. And he studied hundreds of centenarians living in a five longevity prone locations around the world, which were named the Blue Zones. He and his fellow researchers uncovered some very interesting information about how the centenarians in those locations eat. Let's talk about some of their findings. First, as you can see on the slide, portion sizes in America have grown significantly over the last several years, as have waistlines. Many centenarians eat off smaller plates and stop eating before they feel too full. That is the first one. The second one is eat your plants. A mostly plant-based diet is common among centenarians. Those who do eat meat do so rarely and in small portions of about 3 to 4 ounces. Monaco, which is a country located along the Mediterranean Sea, has a long life expectancy of nearly 90 years, according to the CIA's World Factbook. The Mediterranean diet has long been associated with good health. It's rich in fruits and vegetables, legumes, nuts, especially walnuts, healthy whole grains, fish, and olive oil, while shifting the focus away from meat. It may help to add a caveat here. Omega-3 rich fatty fish has many health benefits. So that's something to throw in there as well. And I'll just add, I did, when I was researching for this presentation, I did, Google the Mediterranean diet, and there's lots of ways to, as we said here, this lists those foods, but you can Google it and you can get, actual recipes, you can get diet plans, you can get all sorts of things just, by looking up some of that information. And it really does seem to be a great benefit. And then finally, we're going to talk about the antioxidants. Focus on antioxidants. So antioxidants are chemicals that are believed to help protect the body from the damaging effects of free radicals. They're present in foods in the form of vitamins, minerals, flavonoids, carotenoids, and polyphenols, among others. Antioxidants are abundant in berries, leafy greens, nuts, green tea, and even dark chocolate. So eating a healthy diet, super important. Next thing we want to talk about is staying active. So physical activity is what we're going to talk about next. Centenarian secret number 3, stay fit and active. You know the saying, if you don't use it, you're going to lose it. So guess what? It's true. In order to keep your mind and your body strong, you've got to move. So according to the Centers for Disease Control and Prevention, physical activity can increase your chances of living longer. In addition, it may improve your ability to do daily exercise or daily activities and maintain independence, improve your mental health and mood, and reduce your risk for many conditions, including heart disease and cancer. The U.S. Department of Health and Human Services recommends all adults get 150 minutes of moderate intensity exercise per week. You should try to make it as vigorous as you can, but still be safe. So try to think of less conventional ways to add movement to your day. Being active doesn't always mean spending time in a fitness class or riding a stationary bike. You could be gardening, you could be cleaning, you could be dancing while cleaning or dancing while gardening. Cooking and walking from place to place are all ways to stay active. And I think we've all heard, if you're going to the grocery store, park at the back of the parking lot so you have a longer walk. If you're in a tall building, don't take the elevator, take the stairs up and down. So there's always ways to get extra activity into your life. We just have to be mindful of those ways. And before beginning any new exercise program, as I always say, you want to make sure that you do talk to your healthcare provider just to be sure everything's looking good. All right, so the next thing is avoid heavy drinking and smoking. So centenarian secret number 4, stay away from those unhealthy behaviors like the heavy drinking and smoking. According to the National Institute of Aging, heavy drinking may lead to many health problems, including some types of cancer, liver damage, and brain damage. Plus, it may worsen some existing health conditions too. The National Institute on Aging advises adults over age 65 should have no more than 7 drinks per week. And furthermore, no more than 3 drinks on any one day. And I've seen different stats on that. Actually, this one seems to be a pretty generous one. So, you still, if you like to drink, you still have those days where you can do that. One drink is defined as one 12-ounce bottle of beer, one 8 or 9 ounce bottle of malt liquor, one 5-ounce glass of red or white wine, and one 1.5-ounce shot glass of a hard liquor like gin, vodka, or whiskey. You probably won't be surprised to hear our next tip. If you smoke, you need to quit. According to the CDC, and of course, we hear all about the CDC these days, very important resource. Smoking harms nearly every organ inside the body. That certainly isn't going to do you any favors if you're trying to live to 100. In fact, cigarette smoking is the leading preventable cause of death in the United States, accounting for more than 480,000 deaths each year. So huge numbers. So if you're a smoker, do your best to quit. But the CDC also says that quitting smoking lowers your risk for disease and can add years to your life. So there's definitely, it's never too late. So definitely, work on that if you can. All right. The next thing, and again, it's something we've talked about a lot and so, so important. And, you guys are a good resource with this, is stay socially connected. You want to have a strong social network. Relationships give us emotional support, access up to information we might not have otherwise, and engage the brain in a very unique way. Humans are wired to be social, but as people retire or move to a new community, they often don't have the same opportunities to socialize as they used to. Yeah, I mean, things change. So that's why, if you're moving to a new area, and we definitely have a lot of people moving to Florida and even Brevard County. And so if you're one of those people, get connected, find there's a hobby that you love, look that up, find out where that's happening in Brevard. If you don't know a lot of people, there's meetup groups, there's senior groups, there's all sorts of ways to get connected. According to the Alzheimer's Association, research shows people who are regularly engaged in social interactions maintain the vitality of their brain, safeguarding themselves from physical and mental decline. So don't leave friendships to chance. Be proactive in meeting people and invest in your relationships with your family and your friends, which is great advice. All right, next thing we're going to talk about is staying on top of your health care. As you age, the relationship you have with your healthcare team may be more important than ever. This is because you may be managing more health conditions than you have in the past, and your health has a big impact on other parts of your life. Prevention has become a popular topic in the healthcare world, but until recently, preventing disease in older adults wasn't common practice. Luckily, it's becoming much more conventional, meaning that it's important to partner with your doctor to help develop health goals. If a certain disease or health condition runs in your family, work with your doctor to help or to develop steps to help to prevent this. If you're managing a chronic condition like arthritis or diabetes, create goals which can prevent it from getting worse. And to make sure your doctor has time to discuss lifestyle changes and disease prevention with you, make that clear when scheduling your next appointment so he or she is able to spend more time with you. So if you have those questions, definitely let them know, because so often you do hear my doctor's in and out, I didn't get a chance. And I think we've talked about this before too. When going to see your doctor, make a list in advance, call in advance, let them know you've got additional questions and you might need a little more time with the doctor that day. Keeping up with your regular screenings can also help you age well, because it leads to earlier diagnosis. This in turn leads to less invasive treatment and a better chance for survival. And then lastly, it's important to follow the medication recommendations you've been given. If you have a hard time taking your medicine as directed, talk to your doctor or pharmacist to find a solution. It can help develop a schedule to take your medicine on time and remind yourself with notes, checklists, or even alarms or apps on a smartphone. So you want to make sure you're taking those meds as directed. All right, so you want to stay on top of your health care. that pretty much brings us to the end of our class today. So hopefully the tips that I have shared have been helpful and can help all of you on your journey to striving to be a centenarian. So,
I love what you're talking about with all this. I was thinking as you're going through these tips, there's a good friend of the Helping Seniors organization. His name is Ed Baranowski, and he actually publishes a column in Senior Life magazine, and it's called "Living Well to 100." And I'm thinking, like, well, this is good. Our whole life, right? We're always setting goals for ourselves, right? We want to, this is something we want to accomplish in this amount of time, or we'd like to get this thing to happen in a certain way, and so we plan and we work toward that. And what a great idea if we could plan and take advantage of some of these thoughts in terms of just looking and saying, well, that's going to be our goal. We're going to make 100, and here's how we're going to do it. We're going to do it well.
right. No, I think it's a great goal. And I think more and more of us can strive for that goal for
Yeah,
sure.
I think it's so good. And I really appreciate you sharing this. That's the whole point of the Art of Healthy Living series. And if you're new to this, I want to encourage you to go back. There's lots of different ways you can access this. Vicki Moore has been kind to share her time and the expertise of the company that she works with here, CarePlus, and really helping give us some good tips and information. And along the way on this whole series, we've covered everything from like how understanding organic food labels, which was a huge, I had no idea. You hear all these terms on commercials, but you did a great job of breaking all that down. I mean, we've done stuff on all aspects of living to be 100. If you think about it, I mean, you did a primer on Social Security. You did I think it was called Medicare 101, which is actually kind of close to what you do day in, day out, where you're helping people get the best solution for their Medicare Advantage plan as they're looking, to make sure they're doing the right thing for their health care. And so all these resources exist. They're available. You can search them actually out on the Helping Seniors website. The Helping Seniors of Brevard website is just that, Helping Seniors of Brevard.org, Helping Seniors of Brevard.org, because we're right here in Brevard County, and we're a home-based, locally grown charity organization who, for 10 years now, by the way, has operated the county's senior information helpline. So that's why we exist, is to help seniors chart the best course with all this. So, but number one, you can find these programs, the Art of Healthy Living programs, on their website. You can also, if you like YouTube, you could subscribe to the Helping Seniors of Brevard channel. If you like Facebook, and that's how you like to look at stuff, these programs are also on the Helping Seniors Facebook page as well. So they're great resources. But Vicki, you are a great resource for people looking to get answers. Maybe I know we talked about this, like the main enrollment period is over, but for a couple of things, there may be people who have opportunities to look at things again, and particularly because of CarePlus, you're able to help people examine what they're doing with their Medicare planning really throughout the year. Am I saying that the right way?
That's exactly right. And I will say though, right now, what is today? Today is well,
April 2nd.
we just ended because we're in April. So the OEP was from January 1st through March 31st, and that allowed people to enroll in any plan, any other Medicare Advantage plan if they were already in a plan. So if they kind of had buyer's remorse, they're allowed to make a change, or if the network wasn't what they thought, they can make a change to any other Medicare Advantage plan. And that was January 1 through March 31. But now that we're in April, that is no longer, now most people will have to wait until AEP, which is October 15th through December 7th, unless you are interested in the CarePlus plan. CarePlus is a 5-star plan. This is it's our third year. I think it's our 4th year as a 5-star plan. I think it's our 2nd year in a row. So we're very, very proud of that fact. But what that enables us to do is offer a special enrollment period. So what that means to people out there is that if you're on a plan and you've decided, well, gosh, it's just not the right plan for me, my docs aren't in this plan, or, I don't like this or that about this plan, you can enroll with CarePlus all year long. And so the way that works is if you enroll, say, for example, in April, then the plan would start for you the next month. So it would be May 1st. Or if you enrolled in May, it would be June 1st. But you can do that all year long. So it's we're super proud of the fact that we are a 5-star plan and we're able to offer that to people. And a lot of people take advantage of it because it's got some really great benefits.
Right. And I was going to say, I've seen how you work with folks because you really sit down and take a look at their entire situation. You're taking a look at what they're spending on prescription drugs. You're taking a look at what their medical needs are, and then you're able to help guide them correctly to something that's really going to match up with what they're needing. And it's really pretty cool that you guys have earned the reputation that allows you to be available throughout the year. So if people, and I know you're very generous with your time anyway, you're always willing to sit down and take a look at somebody's. I've seen you work through really complicated cases. I know that I know people that you've helped get situated who had very like I said, complicated situations to work through. And that's what you do. So you're really a great reference and a resource. How do people get in touch with you?
Well, Carrie, they can give me a call at my cell phone, which is 502-777-6277. And we do have a local office here in Melbourne. It's on Wickham Road at Post Commons, 4100 North Wickham, but it has actually been closed to the public for the past year. So really, so hopefully that's going to open soon. And we used to do appointments there, but right now we can still meet with people, but yes, just definitely give me a call. I can answer any questions. And again, it's 502-777-6277.
Yeah, and you definitely want to call Vicki Moore with CarePlus Health Plans. Really, Vicki, appreciate you sharing all this good information. We're going to be back. It's hard to believe we're already in April 2021. Amazing, amazing. But we're going to be back. We're going to be back on the first Friday of each month. So we're going to see you on Friday, May the 7th, with the next exciting chapter. As we're all pursuing this goal of living healthy to 100. I love it. It's a great topic. And thank you, Vicki, for sharing it today.
All right. And thank you, Carrie. Have a great day.
Okay. And on behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, thank you for joining us for today's edition of The Art of Healthy Living. Hope you have a great weekend.